Meena Patel, and I'm the Advanced Nurse Injector and Certified Nurse Specialist at HKB Surgery. And today I'd like to talk a little bit about neurotoxin. There's so many things out there, so many different products, and I'd like to just kind of narrow it in and tell you which ones do what and how they work. So many people ask me when's a good age to start using products. And I always say with, things like neurotoxin, if you can make a wrinkle in your forehead between your brows, or when you raise your eyebrows, if your skin wrinkles up, or when you smile, the skin wrinkles up, that's probably a good time to start with these products. That you may not have them when you're not wrinkling, but that's the time to start it. It's not an age thing, it's really about when you start wrinkling your skin. The way neurotoxins work is that they work on muscle movement. So when we use a muscle, the muscle contracts and gets shorter, and the skin above it then wrinkles like an accordion, and that's when you see those lines. So if we can relax those muscles, the skin above it becomes smoother and it looks a little bit more softer. We try and inject in a way that gives you still lots of movement, makes you still give you expression, but still have a nice and smooth skin. So some of the areas that we can treat with neurotoxins is the forehead area. So when you raise your eyebrows, you see the wrinkles in the forehead. Between the brows, when you frown, you can see 11s. Around the eyes, when you smile or squint, you see lines, we call those crow's feet. Other areas around the mouth, when we purse our lips, we can see lines, we can help relax that. In the chin area, when we raise up our chin, we see the dimpling. So those areas we can relax with neurotoxin. There are other areas we can treat with neurotoxin that really help shrink the muscle, and that's in this area here with the masseter muscle, the muscle that we use to clench and grind. And if you suffer from that at night, you may see that your jaw is a little wider, and that muscle when you clench is big. So that gives a big wider jaw. So we can inject that with neurotoxin to slim out the jawline and really help with clenching and grinding that you might suffer at night. Other areas we can inject is the neck bands. They become more protuberant, and when we inject them, they can soften that, gives you a little bit nice softer contour of the neck. We can inject the upper lip area to give you a lip flip. We can inject in this area to give you less of a gummy smile, and we can also inject in this area that can help lift up the corners of the mouth. So these are just some of the areas that we can treat with neurotoxin. So decide with your injector what your goals are, what you'd like to see, and we can decide together where to place the products. So let's talk about some fillers. So fillers are, most of the fillers that we use nowadays are made of hyaluronic acid. Hyaluronic acid is a very natural product in our skin. It's a very good hydrator, so it helps our skin become nice and smooth and soft. And we have lots of fillers here. We have a family of Juvederm products, and then we have a family of Restylane products that have hyaluronic acid in the fillers. And we use many different kinds for different areas. They are made differently, and so some areas, some products are good for support and structure, and some are for softness, for plumpness and smoothness. So where can we use all these products? There are many different places. We can use, for support and structure, we can use them in the cheek, in the cheek that goes in the front of the cheek, and angle it back. It gives you a nice little contour, helps raise up the cheek, but also gives you a nice little cheekbone. So we can use it to correct and lift, but also to enhance. We can also use some of the firmer fillers to help enhance the jawline, to pull everything back, sharpen the jawline, give you a smooth and crisp look. We can use it to enhance the chin. These firmer fillers can help make the chin look a little bit more smoother contour, more in line in your profile with the rest of your face. Some of the other fillers that we can use are more for softness and smoothing. So if we have some fine lines, perhaps in the nasolabial area, the marionette lines, some of the fine lines around the mouth, we can treat that with a different type of filler. Lip fillers, there are numerous of them. Some give you big lips, some give you smooth lips, some just give you a little bit of plump. There are so many different ones, and really the best thing to do is just have a really great conversation with your injector and allow her to choose with you the right product for you. So lastly, let's talk about biostimulants. These are also fillers in a sense, but what they do is actually encourage your body to make collagen. And we all know that collagen is one of the things that we lose over time. In our 30s and 40s, we start losing them. And obviously, as we get into our 50s and 60s, we've lost a big proportion of them. And it gives us that aging look. So what we want to do is trying to stimulate more collagen to help give our skin a little smoother, softer, stronger look. So some of the areas we can use these biostimulants are areas that we may not use hyaluronic acids. So we can use these in the hollows of the cheek, in the temple area. We can use it in the neck to give it a more smoother effect, and help with some laxity. We can use it in the knee area if we've got some wrinkling, and that can help smooth that out over time. And even in the buttock area, we can use it to enhance the buttock a little bit, but also give it some firmness and smoothness. So another thing to consider is also the skin itself. So while we're treating everything with fillers and neurotoxins and stimulants, we also want to consider the surface of the skin, the texture, the quality of the skin as well. And we can do that with good quality skincare, medical grade skincare, and even prescription grade skincare. We offer all of those here, and then we have a vast array of lasers that we can use as well. So we'll select a lot of those things that work with you, with your downtime, whatever you need, and trying to create a really nice plan together. So when you come in for a consultation, you'll meet with your injector, and we'll listen to your goals and what you'd like to see, and we'll select together the right treatment plan using the products that will work for you.